Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Vitamin D affects many aspects of our immune system and resistance to infection, including COVID-19 and all other viruses. Now, for vitamin D to work, it has to be activated. Importantly, many immune system cells can activate vitamin D. That's an important finding. At one time, we thought only your kidneys could activate vitamin D. Now we know that our T cells that trigger antibody responses can actually convert vitamin D into its active form. This shows how important vitamin D is to immunity. Now, vitamin D is needed to activate immune system cells, but also to control the immune system so it attacks the virus and doesn't cause collateral damage to us. Now, the damage to our body connected to COVID-19 comes from the cytokine storm. It represents out of control immune system activity leading to harm. Usually this battle is fought in our lungs and it could cause severe lung damage, even death. Zinc helps suppress dangerous immune system malfunctions such as this and consequences of an overactive immune system. So we aim the immune system at the virus, not at us. In any event, welcome to our COVID-19 Take Your Vitamin D episode. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm the Chief Scientific Officer over here at Invite Health. And thank you for joining me on this episode. So let's go over some of the reports, some of the data. This is Angers University Hospital in France. It's published recently in the journal Nutrients, November 5th. Elderly patients who previously have been taking vitamin D3, D3 usually works better than vitamin D2. Elderly patients who have previously been taking vitamin D3 supplements are more likely to survive COVID-19. But a single standard dose of 80,000 units of vitamin D3 after you're infected is probably too low and too late in the day to have its protective effects generated. Now, vitamin D, we know it's for the bones, but it supports key functions in many organs, like our brain, our muscles, our pancreas to help control blood sugar, but also our immune system. That is a very fast-building archive of studies linked to vitamin D deficiency and more severe COVID-19 symptoms. There's been inverse associations found in European countries between the level of vitamin D in your blood. We look at the serum, the red stuff in the blood, and the number of COVID-19 cases, as well as with mortality. So they're finding a strong connection. If you lack vitamin D, you're more likely to get COVID-19. The COVID-19 is more likely to be serious and even beyond serious, deadly consequences. So the hospital in Angers, France, wanted to see if vitamin D taken regularly before you had COVID-19 or taken in a large dose after you developed COVID-19, is there something to it? Now, these are frail, elderly people. They're frail, elderly COVID-19 patients. So it's the Jerry COVID study. 77 patients between 78 to 100, about half were women, hospitalized in the geriatric acute care unit of the hospital. Here's what they found. And the elderly patients who experienced severe COVID-19, vitamin D supplementation taken on a regular basis before they got sick was strongly associated with less severe COVID-19 and better survival. But if they gave you a big bolus shot, if they gave you an 80,000 unit capsule after the diagnosis, it didn't improve your outcome. So it's something you have to take on a daily basis, really. They found that many studies are finding that if you take vitamin D on a regular basis, we call that prophylactically, you have a reduced risk of respiratory tract infections in general. In fact, there was a meta-analysis showing that where they took many studies and put them together, and they said, hey, vitamin D helps prevent respiratory tract infections. That could be anything from the flu to a cold to COVID-19, but also helps prevent pneumonia and helps prevent the severe consequences of these infections. So this is a AZ Delta General Hospital in Belgium. This is a brand new report. It came out December 11th. A vitamin D deficiency on admission to the hospital was associated with a 370% increased odds of dying from COVID-19. Let me repeat that. If you were deficient in vitamin D on admission to the hospital, you had a 370% increased risk of dying from the infection. They found that nearly 60% of the patients with COVID-19 were vitamin D deficient upon hospitalization. And men in the advanced stages of COVID-19 pneumonia showed the greatest deficit. So why should that happen? Well, women are treated for bone loss during menopause and after menopause, so they're getting vitamin D. So in general, there tends to be fewer women with very deficient vitamin D compared to men. So, and they looked at all these other more comorbidities like obesity and diabetes and lung diseases, etc. And they found, hey, listen, it's really the vitamin D. So they go on to explain numerous observational studies have shown that low vitamin D levels are a major predictor for poor COVID outcomes. So, in other words, it's getting more serious. This is Jacob Teitelbaum. He's a medical doctor who's well known. He's a researcher in the United States. He said this study shows how severe a problem this is. So now, Dr. Teitelbaum was being interviewed by Medscape Medical News. Medscape is a teaching platform for pharmacists, medical doctors, nurses, podiatrists, dentists, and other healthcare professionals. So Dr. Teitelbaum goes on to say, a 370% increase in death rate if someone's vitamin D level was below 20 is staggering. It is arguably one of the most important risk factors to consider. Now, Andrea Justina, he's a medical doctor, he's the president of the European Society of Endocrinology, said the paper by Dr. D. Smet and et al., his confederates, confirms what we already hypothesized in British Medical Journal last March, that patients with low vitamin D levels are at high risk of hospitalization for COVID-19 and developing severe disease and even lethal disease. He goes on to say the new study should prompt all clinicians and health authorities to seriously consider vitamin D supplementation as an additional tool in the fight against COVID-19. So it was 186 patients hospitalized with severe COVID-19 infections. They found out they had pneumonia. Many of them had pneumonia. They looked at their vitamin D status, as well as risk factors such as diabetes, chronic lung disease, heart disease. And they found a big difference. A remarkably high percentage of the patients were not just low in vitamin D, they were actually deficient in vitamin D, levels below 20. Among men, rates of vitamin D deficiency increased with advancing age. There's a big correlation here. There really is a correlation between severe disease, respiratory diseases related to infections and low vitamin D. So here's Boston University. The association between vitamin D status, in other words, how much vitamin D is in your blood, and COVID-19 risk continues to strengthen. So this is data from Quest Diagnostics and Boston University. People with the deficiency in vitamin D have a significantly higher rate of being sick with COVID-19, SARS-CoV-2. They went on to say, this is in PLOS One, it's a great American medical journal, and it's Boston University. And they found that you had a 54% higher rate of getting COVID-19 if you were low in vitamin D. In addition, about a month ago, a team of scientists from the University of Chicago reported results from a retrospective study of almost 500 University of Chicago patients. And their vitamin D level was measured a year before being tested for COVID-19. And a team from the University of Chicago found that patients who had vitamin D deficiency that was not treated were almost twice as likely to develop COVID-19. So not only lacking vitamin D allows you to develop the infection, but lacking vitamin D allows the infection to really attack your lungs and become dangerous. They find out it's involved with acute respiratory distress syndrome. You get viral pneumonia from the virus, and then it inflames the lungs so severely that you build up fluids in the lungs, and you get admitted to the intensive care units, and you require oxygen, sometimes intubation for oxygen. So in the Boston University study, Boston University School of Medicine study, they found in PLOS One, they found that the hospitalized COVID-19 patients who were vitamin D deficient with a level of vitamin D below 30, they had a much higher risk for becoming unconscious, the body starving for oxygen, we call that hypoxia, and dying. Plus, they had a great deal more inflammation. You could test that by looking at something called C-reactive protein in the blood. So here's the University of Siena. Let's go to a quick break. I'll be right back.
Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Okay, welcome back. Jerry Hickey, Invite Health Radio. So here's a study on vitamin D in the University of Siena in Italy. And they found out that patients hospitalized with COVID-19, if they were deficient in vitamin D, they had worse outcomes. In other words, scary stuff going on here. Low levels of vitamin D in hospitalized COVID-19 patients were inversely associated with the development of acute respiratory distress syndrome. Plus, if their vitamin D was below 20, they had a higher mortality rate. So, I mean, this is scary stuff. And vitamin D is not expensive. It's really easy to get a hold of. It's really easy to take. The doctors now should be shouting out from the rafters, hey, take your vitamin D. Take your vitamin D. In fact, Trinity College in Dublin came out with a big review not very long ago, and they said just that health professionals should be telling at least all healthcare workers, as well as elderly patients, get on your vitamin D. It's not going to hurt you, and it's really beneficial. So here's the journal Nutrients, September 10th. It's the Department of Internal Medicine, University of Heidelberg in Germany. So these studies are coming in from England, Germany, France, Spain. They're coming in from all over, the United States, from all over the place. It's 185 patients diagnosed with coronavirus and treated at the University of Heidelberg Medical Center. They said that the need for mechanical ventilation, if you were vitamin D deficient, increased by 612%. Okay, you had a 612% higher need for mechanical ventilation, not just getting oxygen, ventilation, if you were deficient in vitamin D. And what was the risk of death? 1,473% higher. 1,473% higher if you were lacking vitamin D. I mean, it's just not great. You should be on vitamin D anyway, because vitamin D has been connected to a lower risk of some cancers and also surviving those cancers. And vitamin D is also connected, if you're low in it, to a faster loss of mental function, mental acuity, and memory, etc., in older patients. So the research shows that vitamin D blood levels if they're higher, you have a lower risk of contracting COVID-19 and a lower risk of it becoming severe, a lower risk of winding up in the hospital, and a lower risk of dying. So here's Dr. Joan Lappy. She's an associate dean for research, and she's a professor in the College of Nursing at Creighton University. That's in Nebraska. She said cells in the body need an adequate amount of vitamin D to function efficiently, but also to boost one's immune system. Dr. Lappy recommends taking at least 2,000 international units of vitamin D a day during the winter. Now let me explain. And here's what I strongly believe from reviewing hundreds of studies on vitamin D, most connected with the immune system. Your vitamin D level drops over the winter. But also, obese people do not utilize vitamin D very efficiently. There's a reason for that. Vitamin D gets trapped in their fat cells, and there's not enough floating around the bloodstream for the immune system to activate to help the immune system function better. So I'm telling normal weight, healthy people 2,000 units of vitamin D3. D3 seems to work better than D2. Vitamin D3, which is called cholecalciferol, every day with food. Take it with food, it's absorbed better. But if you're obese, or if you don't have a well-functioning immune system, like you're diabetic or you have severe heart disease, or something that's messing with your immune system function, I would take 2,000 units twice a day with food. And I would take it every day. It seems to work much better if you take it on a daily basis than if you get a very high dosage every once in a while. So thank you for listening to the Invite Health Podcast. You can find all of our episodes wherever you listen to podcasts. Please subscribe. Please leave us a review. You could follow us on Facebook, Twitter, and Instagram at Invite Health. And thank you. I hope to have you. Oh God, this is awful. Ruiz, I'm going to do it again. Thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or you could just visit invitehealth.com, our loading page on our website. If you just scroll down, you'll see a big icon for our podcast. We have several hundred up there now. Please make sure you subscribe. Please leave us a review. I'd love to know how I'm doing. You could follow us on Facebook, Twitter, and Instagram at Invite Health. Hope to see you another time on another episode of the Invite Health Podcast. Thank you for listening.